In our first story, we meet a boy living with the realities of polio. The disease affects the nerve system and causes paralysis. Here is his story.
This story is about a child who was affected by polio at the tender age of 1. It is a story about a boy who has had to grow up different from many of the boys his own age. Stephen has difficulties living in the community. Everything he does requires help. He is 12 years old now, but even with the little tasks like washing his face, someone has to help him. Polio is a crippling disease that mainly affects children under the age of 5. The disease is contracted through fecal oral transmission and is easily facilitated by slum and unhygienic environments. Vicenzian Igali is Stephen's mother, and she has had to see her child suffer from a very young age.
Yaki yom tani sabala pena gamulu say. You see be bes gombe kurato.
One day, early in the morning, when I was making tea, I saw Stephen rising up on his feet. I then saw him holding a chair. Then Stephen took hold of the chair and fell to the ground. I then said to myself, what is happening with my child? Why is he falling down? What is it?
Stephen cannot even walk. It takes him quite a long time to put on his leg braces before leaving for school. He did not receive polio immunisation. Stephen's mother, a housewife, has exhausted everything within her means to improve her son's condition, and yet she still sees him struggling daily to get to school.
He was not immunized for polio.
He starts his long journey early. It is approximately 2 miles to get to his school. Stephen leaves earlier than the rest of his schoolmates if he is to start lessons on time. Walking to school from home is a struggle. Falling every so often has not dampened his spirits to walk the 2-mile stretch back and forth. He is often assisted by friends or passers-by, and falling for him is nothing new. Stephen is a confident and active student. He participates in school activities and he is very social. He lines up for devotion and walks to his classroom ready for the day's lessons. When he is not using his crutches, he uses other means to support himself. He stops at nothing to make sure he gets his education, and his efforts are duly rewarded by his classmates. In recent years, a UN-backed polio immunisation campaign in Southern Sudan has targeted children under the age of 5. The region experienced an outbreak of the disease in 2008 after having been polio-free for the last 3 years.
The effort to reach every child at every corner of the 10 states of Southern Sudan has been difficult, but we have tried our best. And that is why we keep on repeating the campaign. This is the first campaign this year, and we hope that we'll be able to cover 100% coverage of our children in the 10 states of Southern Sudan.
Inaccessibility in many areas due to a poor road infrastructure in the south remains the main challenge hindering the efforts to curb the disease. But the government of Southern Sudan's Ministry of Health, the World Health Organization and the United Nations Children's Fund are determined to eradicate polio.
It's important that the children get the polio vaccination so that we are ensured that these children will not have any problem with their health in terms of being able to use their limbs, because polio is final, it doesn't have a cure, and it affects children.
Since Southern Sudan's referendum in January 2011, hundreds of thousands of internally displaced people and refugees have been returning to the south. This has added new challenges to the campaign.
We are targeting 5 million in this fourth campaign, and you can imagine getting 5 million across the 10 states of Southern Sudan. We are also specifically targeting our IDPs who are coming back with children. We know that we have many children who have been brought from the north, many children coming from Uganda, from Kenya, from other bordering countries. So we also want to ensure that these children get vaccinated.
Stephen was not so lucky. Had he received vaccinations as a child, life might have been very different. Going back home is difficult, especially when there is no one to walk with him. His friends move much faster than he does. Polio is a dangerous disease that cripples children for life, and immunisation is the only means of protection. Until polio is completely eradicated, all children in Southern Sudan are at risk of a lifelong paralysis or even death.